Hey everyone, I'm Dr. Macedo here with Westhills Equine Veterinary Services, and I'm going to take you today for a little tour on my world down in Reproland. So you're going to see a whole lot of ultrasounds, stallion collections, inseminations, embryo transfers, and all of that can happen in a given day at our barn down there. And we're also going to take you to a little bit on the behind the scenes where Alana runs the show and make sure that we have everything under control for your horses.
You may not see me every day, but I'm in charge of the daily phone calls, all the emails, all the stallion collections, most importantly some shipments, and keeping these guys in line.
Pretty much. So please follow us. So we're going to start off the day by doing some ultrasounds. So we're going to go rectally and check those ovaries and the uterus in order to determine optimal time for breeding. So imagine the uterus is a big T. So for either side of those arms, we're going to have the ovaries, and that's what we're seeing here. So that's a big follicle on the left-hand side ovary. So I'm going to scan down that left arm, and we're going to assess the uterus and see what is going on in the uterus. The things we're looking for at this point are the endometrial folds to determine if we have any edema there. That would be an indication of heat cycle in this mare. So I'm scanning down, that's the uterus up there, going all the way up to the right ovary. So I don't have much going on the right ovary, coming all the way back down. And I go to the left ovary where I have what we call a dominant follicle. So this dominant follicle is over 35 millimeters or 3.5 centimeters, meaning that we can induce ovulation on this mare. She's going to be bred to frozen semen, so the drugs we use to induce ovulation are our best friends. Okay, after we scan the mare, we have to make sure we have the medical record in place. So we do have a reproduction software management here at the practice as well. So since I scanned this mare, I know where she's at. I input into the medical record here, and we are ready for the next mare. So this patient here hasn't conceived or hasn't had a baby in the past 2 years, so we might need to do some investigating on her. So the first step is to throw an ultrasound in there, make sure the ovaries and uterus look normal and everything's up to date in there. And the second step would be a culture and cytology. What that will tell me is that if we have any bacterial or fungal infection going on in that uterus, as well as if there's any inflammation going on in there. So there's a few methods for culture and cytology in mares. I'm going to be discussing the first two, or the most commonly used here at Westhills. The first one would be a swab, a uterine swab. So of course we're going to go sterilely into the mare. This is just for demonstration, but it's a double guarded uterine swab here that we have. So we introduce this through the cervix into the uterus, and then we push through with the second guard, break it, and eventually make it into the uterus with the swab. And we get the cotton swab swirled around to make sure we get a representative sample of that uterus there. Retract it back, pull the blue guard as well, take the sample, go into the lab. After we obtain the culture swab, we are going to go for a uterine brush. The procedure is similar, so we go with our double guard into the uterus, and then we're going to have a brush at the end of that stylet there. We're going to scrape around into the uterus and get a sample of the cells of that uterus to make sure they look healthy and good for breeding. The second method for that uterine culture in cytology is a low volume uterine lavage. So that means instead of going with that double guarded swab, we go into it with a uterine lavage tube, get into the cervix, deposit a little bit of fluid into that uterus, squish it around, get that sample back out, and then go into the lab with the fluid. Okay, so after we collect our samples from the mare, we come into the lab and we have our litter incubator for the cultures, and we put our cytologies on a slide, glass slide, and look under the microscope. There's a few things we're looking for when we look under the microscope. We're evaluating how healthy the uterine epithelial cells look, if there's presence of any bacteria, and some cells called neutrophils that will indicate inflammation in the uterus. I have two cultures of two different mares. So one of them is a pre-breeding exam. So we just want to make sure everything looks clean and the mare is good to go. And here is a very clean plate. And here's the example of a mare who has been problems catching or conceiving for the past 2 years. We did a culture and cytology to start on her, and she is dirty. So you guys are going to take a quick look at this plate here shortly. So after we know our mare is dirty, so she has a bacterial infection in the uterus, we have to identify what bacteria we're dealing with. So that's why we have our little chart here. So just compare our plate to the chart. So once we have identified what bacteria is present in the uterus, we try to do a sensitivity test. That means we try to kill that bacteria with several different antibiotics, and based on that, we determine what's the best therapy for that specific mare. Okay, so once the mares are ready to be bred, we have a few options, either frozen semen or fresh semen. So we have a few stallions standing at Westhills with us this year, and they're going to be breeding a few of the mares here at the clinic as well. So we collect those in clinic to breed the mares in clinic as well. So there's two ways we can do that. Using a Missouri artificial vagina or a Colorado artificial vagina. So now Jezebel is ready and the stallion can be brought into the breeding shed.
So this is JD Wagon Boss. He's standing with us for the 2021 season. He is an own son of PYC Paint Your Wagon, and he's been great for us so far. Got a lovely personality. I've heard he passes that on to his foals, and we're excited to see what he does for us. This is Guys Keeping the Fame. He's owned by Sierra Stupel. I've actually been working with him for a couple of years now, and he's been fantastic so far. He's a great stallion. His offspring are just starting to perform now, and we're really excited for him. He's just great to be around.
Once we have the stallion collected, we need to process the semen. The stallion we collected today is for shipment, so we have 3 mares waiting on the semen. So we do our analysis using this iSperm protocol here. So I'm going to give you guys a close up on this sperm right there. So after we collected the semen, did our analysis here, we got all of our numbers, we're going to calculate how many breeding doses this guy has given us today and ship to the mares that are waiting for him. Ideally, we like to send 1 or 2 breeding doses per mare. So if they give us good numbers, we can certainly do that. Today, our big guy here gave enough to breed 13 mares. So we're gonna ship 2 doses per mare. Semen was collected, processed, it's ready to go, and this mare ready to inseminate. Okay, so here at Westhills, after the mares are bred, we all do our pregnancy dance.
So we just finished collecting a couple of stallions this morning. I have a couple shipments going out, which is what you see behind me in the little fresh semen boxes. I have a couple empty returns for some dry shippers, and we're gonna pack a frozen semen shipment right now. So whenever I'm packing a frozen semen shipment, first we go into our system and find out where the frozen semen is. In this case, it's in our Westhills large tank, which is the storage tank in front of me. I have my charged dry shipper, which is charged with liquid nitrogen, and I have my semen transfer box right there. What I'm gonna do is pour some liquid nitrogen in there. It's very important that this frozen semen never leaves liquid nitrogen for more than a couple seconds when transferring. I have a cane right here with a little goblet in it. That's what's going to be used to transport the semen.
Thank you everyone for tagging along. I hope you learned a little bit from us today. So if you have any other questions, please just give us a call. Thank you.